This is a Byja Broadcast Enterprise show.
The fun thing is if you actually did it the other way around, where you prioritize your health over the job, you probably are going to keep both. But if you prioritize your job over your health, you're going to lose both.
If this podcast continues to grow and it continues to do what it's been doing, and I may have to wear disguises in public when I go to the mall and when I go to the grocery store, like Michael Jackson did.
The idea is that there was a study that came out in 2022 about TikTok, and it examined medical content found on the platform. And what it found is the majority of medical content on the platform on TikTok was actually inaccurate. The majority, so over 50%, was inaccurate. They had incomplete information, misleading claims, and basically
Absolutely.
a lot of anecdotal experiences that were presented as facts.
However, let's not cut corners or try to help your finances by not seeing people like Dr. Jasper and relying on ChatGPT, WebMD to take his place. Or God forbid, mushroom coffee.
Here comes Byja Radio. Byja Radio. With Dr. Byron Jasper and PatientZero.
Welcome to the Byja Radio Show, recording live.
The content in this show is intended for informational purposes only and does not constitute medical, diagnostic, or treatment recommendations. We do recommend that you seek the advice of your physician or other qualified healthcare provider with any questions regarding your health.
All right. Yes, again, we are back for another amazing episode of Byja Radio. It is the 5th season of Byja Radio. And with the 5th season, that means we are probably on episode 48. And episode 48, we feel is going to be a very interesting topic, and a topic that may be a little off the beaten path, but a good topic. And if I say we, that must mean I am in the host seat with an amazing co-host, the co-host that everyone really and truthfully comes to see. And I'm pretty sure when he's in the mall or a grocery store or at even a car dealership or a, professional basketball game, people stop and just say, oh, it's this guy. And I know him. He's a celebrity of all celebrities. PatientZero, how you doing today, brother?
Bro, I'm fantastic, brother. And you always make me feel pretty good. You got my head big. I already wear 7 3/4. But you got my head big talking about celebrities. I recently saw the Michael movie. And let me tell you, that dude was a genius. Like, I already knew he was a genius, but he was I'm even more impressed with who Michael Jackson was. So when you talk about the celebrity, that's the guy. Now, I will say, if this podcast continues to grow and it continues to do what it's been doing, and I may have to wear disguises in public when I go to the mall and when I go to the grocery store, like Michael Jackson did, because that's what he did. So, let me know what type of disguises y'all think I should have when I go to Walmart and when I go to Albertsons and Whole Foods. Like, should I go with like a wig? Should I have like this big crazy beard? You know what I mean? I need to know what type of disguises I should wear.
I think that's a valid question, my friend. And I think the other part that people should realize is that we are getting that momentum because we are doing the work that most people don't want to do. Most people don't want to talk about these topics and talk about them in depth. They want to, be what we would call clickbait, right? We want to give you something that you click on, you watch, and you don't remember it 5 minutes later. We're trying to actually be in your brain and in your back pocket well after the show is over. And if that works, then again, PatientZero now needs disguises. So to make sure we get to PatientZero and his disguises, we need you to like, subscribe, and share. We need to follow. We need you to comment. We need to do all the things. And PatientZero did an amazing job because I always listen back after we record and also after we put everything out. And he did a good job of doing a public service announcement. In his public service announcement, he said, if you are listening this far and we are really good in doing something and you're learning from us, you need to share with your friends, your family, put it in the podcast, put it in the group chat. I thought that was amazing because most people don't even want to do that. They want to keep us all to themselves. And, we need to be shared with the masses so PatientZero can get a sparkly glove. If we do that and we do it well, that means we have arrived, people. So we're going to kick off episode 48 at this point by doing the work of not only getting PatientZero to have disguise-worthy celebrity, but we want him to also talk about this topic that I think a lot of people may be surprised about, even though they know it to be true, they experience it, they just don't realize and often say that this is something that they have been needing research and help with. All right. So, patient zero, what I'm going to talk about in a very quick sense is basically over indexing health information, over indexing health information
That's a
into a
good
way
one.
where people are oftentimes going into social media, online internet searches, and even AI and using those resources beyond what I believe they are helpful for. They're no longer using the resources as tools, they're using them as the answer. And that answer oftentimes causes more harm than it's meant. And I think that's also not helping at all. So the harm ends up being more problematic than the help that it's intended to give the person. So, with that, patient zero, I shared some stats with you, and I shared some stats with you on the very beginning of the notes because this topic is a little nuanced, right? It's not a lot of statistics that are out there about this, but I think as we talk more about it, people will start to realize what we're talking about and how it really and truthfully impacts them. And maybe this is something they're experiencing on their actual phones and internet searches or within their household. But I want you to give us some of the stats that we would talk about for this topic of over indexing healthcare, online, social media, AI, and things of that nature. What you got, patient zero?
Sure. So, it's really, really interesting, when you send me these stats, because some of these are spot on and some of these are like wild, right? Like, for example, 72% of adults search online for health information, right? That's believable. Everybody's got the internet in their pocket these days. Everybody's got a smartphone. You know, it's easier to try to track down your doctor it's easier to look online than track down your doctor in a lot of situations. So I believe 100% that 3/4 of the adults on earth search online for health information. Now granted, when you do that, a lot of times you're looking for information about stubbing your toe. WebMD is going to tell you you're going to die and you're going to freak out, but that's just what's out there, right? No hate to WebMD. Please don't come after me. 36% of people now get their health information from social media. To me, that's a lot. You get on Instagram, you get on TikTok. I don't know about y'all, but I'm looking for foolishness. I'm not looking for like health diagnosis. I'm looking for, maybe an alligator eating a dog or something, but I'm not looking for that. 22% of people, which is a little low in my opinion, use AI chatbots for health information. They're using the Chat GPT, they're using Copilot, they're using Grok and all these other things. So that's a little low to me. But I guess the main idea of those three pieces of information is that people are going to the internet for health information. Now, something else that's been used a lot by adults or what we would call like a wearable, right? It's a device that syncs with your phone to give you some type of health information. The newer thing is the Aura Ring. You've seen like the Fitbits, the Apple Watches, the Samsung Watches, all these good things. Now, the wearable usage has climbed to over 1/3 of adults. Now, obviously, it started out as a pedometer to see how many steps, you're taking. That was what, 10, 15 years ago, where it was like, oh man, I got to get my steps in. But now they give you other information like critical sleeping data. They give you information about your heart rate sometimes. They give you information about your blood flow, things of that and the other. So it's really getting to the point where on your phone, there's a lot of health information out there. And I guess to sum all that up, health is no longer occasional. It's not once a year, twice a year when you go to your physical and you go see your doctor. It's all in your face. There's constant information about your health, man. I get on Instagram, man, looking for my little foolishness, and I'm always seeing some stuff. I'm seeing how mushroom coffee is going to change my life. Like I'm not going to have any type of health ailments if all of a sudden I drink mushroom coffee. Or if I want to enhance my performance, I can't kind of go that deep because it's a family show. But if I want to enhance my performance, all I need is a blue chew and I'm going to just be out here changing lives, right? Those are the type of things that just come online and it's just all in your face all the time.
Mhm.
But the point is, health is no longer occasional. It's
Mhm.
not something that you only think about when you go get your physical or when you're not feeling well. Health is on the forefront of your mind, positive or negative, every time you open up your phone.
Yeah. And I'll jump in and say that we already know a lot of the things that you mentioned. And a lot of people, I don't think, would flinch at the idea that health is always on your phone. It's always in your pocket. It's pretty much at your fingertips. Whereas in the past, 20, 30, 40 years ago, if you needed health information, you had to physically get up and go to a facility to find this information. And that facility could have been one of two places for the most part. It was either a hospital / clinic, that's one facility, or the library, right? You would have to physically go and try to check out a book and read and learn about this because you weren't just able to pop in and get all this health data, health information, which in a way was somewhat a curse for some people who just didn't have access. But it definitely would be a gift for some people where you say we're not over indexed on health information all the time. We do know younger adults are now going to places like TikTok, YouTube, Reddit, and other platforms to find health information. And more importantly, which I think is really surprising in a way, but maybe not, a lot of people would probably say they get this, that most adults, before they seek information or clinical visits with a health professional, they usually just search their symptoms and try to figure it out on their own. Now, why is this coming up on this topic for this episode? The goal for us is to make sure people understand that in a way that's okay. But when you start to go down the rabbit hole, it can cause something called cyberchondria. So, cyberchondria, like hyperchondria, is that you are now online and you're so worried about health and health related things, you're going to start getting online. And that cyber search is going to make you more sick. It's going to cause more harm. It's going to cause more illnesses that make you all of a sudden start to feel like every single thing that you potentially feel, from an ache, a pain, a sniffle, is actually going to be the worst thing in the world. As PatientZero just said, you're now having pain in your foot because you banged your toe on the end of the bed, and now you think you need to have it amputated because something you read online is now freaking you out. Now, some people may hear this and say, well, that's not really a big deal because it's not me. Believe it or not, it's a lot of people who you may actually be in the room with. And these people are starting to walk around and now worried about every little thing. I'll give a very simple example. I have people who come into my exam room all the time, PatientZero, and the first thing that they'll talk about besides their symptom is that I looked it up online and it says this. And some of the stuff is so far off base from what it really and truthfully should be that we literally will start to have to tell people, stop looking stuff up online because it's going to make you feel worse than what really is going on. And now the wearables, as you mentioned, how many steps am I getting in? What was my sleep score? Did I sleep and get a certain rating? And it's all these things that are making people so hyper focused on the numbers, on the data, on the actual information, that they're not actually focused on the activity and the goal that they set out. It's not about how many steps you got in. It's hopefully that you got in enough steps that you feel better. It's not about how well you slept that you got a certain score. It's that you're getting more sleep that's more appropriate and you're now feeling healthier. If we're not focused on the actual activity well enough to be able to get to a certain level, we're more focused on the data than the actual destination, we're going to end up having a problem. And I think we're starting to see that with things like cyberchondria. So, PatientZero, I'm going to ask you a simple question. If you had to think out loud where you would say people tend to get the most data when it comes to social media, what platform would you say people are tending to go to get the most health information at this point in time? Now, we have a bunch of different platforms, right? You got websites, you got social media, have AI. Where would you say people right now, as of this episode, May of 2026, tend to gravitate towards to get the most health information based on you're seeing the people you're around, things of that nature? I have two places I will say, but I'm going to go to you first.
So my assumption would be Instagram or TikTok. And the reason why I say Instagram and TikTok is because there's certain health information that's driven and that's brought up to you via algorithms and things like that. So every other platform that I can think of for medical information, I have to literally go out and seek medical information. But if it's being served to me unintentionally on my part, then I feel like I would get the most information from there. And it's easier just to go down a rabbit hole. So for all those reasons, I would say Instagram and TikTok.
Yep. So you spot on. It is literally Instagram and TikTok. And I looked it up and I didn't put this in your notes, but I wanted to actually bring it up because most people who are social media based would probably agree with those two. The idea is that there was a study that came out in 2022 about TikTok, and it examined medical content found on the platform. And what it found is the majority of medical content on the platform on TikTok was actually inaccurate. The majority, so over 50%, was inaccurate. They had incomplete information, misleading claims, and basically
Absolutely.
a lot of anecdotal experiences that were presented as facts. And what do we mean by anecdotal? Well, I have a friend who was a friend of a cousin, and the cousin told me that when I take this, this happens. And all of those things are driven by the word that you said that everybody potentially knows, but they may not understand. It's an algorithm. The goal is to keep you glued to the site. It's not meant to make you healthier. It's meant to keep you entertained. And if you're entertained on the platform and you're watching and scrolling, clicking, scrolling, watching, clicking, scrolling, and continually do that, you're not actually getting healthier. You're getting sicker. Whether you're sicker physically, mentally, or both, you're going down this platform that you think is giving you health information that's valid and going to literally make you better, only to find out that you're actually in the same exact place you were when you started going down this health rabbit hole, but maybe even worse off because you've been scrolling for 15, 20, 30 minutes and didn't get any health activity in, but yet somehow you're feeling sicker or worse because they've now led you down the platform of all the things that could be wrong with you. So less than half of the popular videos on the TikTok platform were actually accurate. Less than half. I want you to think about that. You're watching the popular video that's fed to you, and you're made to think because it has so many likes, views, and details in it, where people are commenting, high-fiving, and sharing it, that it must be accurate. That's not how this works. The
It's not.
accuracy of the video has less to do with the algorithm than whether people really and truthfully are polarized or sensationalized by it. So that's why the self-diagnosing, the symptom over-identification, all of these things start to be a problem because now it's more about entertainment than health. And that's something that we don't tend to do here, right? We're not over here doing stunts and pulling out cadaver parts and trying to get people to click on stuff just to make themselves more entertained. We're trying to make it to where you can literally say, I come to this show because they give it to you straightforward. And when they do it in that way, we are able to literally learn something and go and research and confirm what they said is accurate. We're not just talking about stuff. We're not just saying stuff. We're doing stuff that literally will hopefully give people a way to live longer and healthier, happier lives. So I bring all that up in a soapbox type of way, PatientZero, to just see if that sounds like something that makes sense to you. And are you surprised about half or over half of the videos being medically inaccurate on these platforms?
I'm not surprised at all, Doc. And I'm going to say something. I'm going to make a point that's going to be painfully obvious to everybody, but it needs to be said. So, Dr. Jasper, for you to give advice to patients, tell the people what you had to do.
The simple version is go to school a very long time, and a long time is a minimum of 11 years. That's the minimum.
Okay. What else you had to do?
So usually go through training as well. So not just the school, but the training. And the 11 years is encompassing of the training as well. And that training is usually 3 or 4 years minimum. And I think I know where you're going with this. I also had to take a bunch of tests and pass. And then I had to get licensed, and I had to, in essence, get certified, aka board certified, by a governing body that says you are, in essence, legit to practice medicine and give people health advice and do it in a way that's safe.
Okay. So, how long that took?
So board certification, if you are, in essence, trained and learn in those 11 or so years, the board's probably is about an 8-hour or so exam, and basically takes all day for 8 hours for you to pass this exam on all the medical knowledge that you've gained.
Okay. So, 11 years of medical training. So, for me to go give some advice on Instagram or TikTok. I had to create an account. 11 years, 30 seconds. I mean, it's just as simple as that. We got look, don't get me wrong. I love technology. I'm not one of these people. I know we established last week that I was old man, get off my lawn, right? And I'm kind of like that in some aspects, right? But when it comes to technology, I love it. I love the fact that I got access to everything. I love the fact that I can understand what's going on with Meg Thee Stallion and Klay Thompson, even though it's none of my business. I love the fact that I could check the scores, all this stuff. I love the technology. But when it comes to medical advice, let's use some common sense. Everybody and their mama could be a blogger, podcaster. Everybody and their mama has an opinion. And that's some of the great things about social media. Because everybody has an opinion, everybody has a platform. But when it comes to my health and the things I need, give me the dude that went to school for 11 years and had to pass all these exams and not the person that just had to create an account. And that's all I got.
Yeah. And I'll add one little small part to it, and I think we'll at least close out segment one. What we also see is a lot of people fast track getting their training, and then they are quick to grab a microphone or a camera or both and start giving out health advice. And people like the show. They don't like the information. They don't like the actual boredom that comes with the success of consistency. They like the idea that this person has a lot of lighting, a lot of fanfare, and they're very charismatic, and yet somehow they're selling you a product and they're basically milking the idea that you are looking for a solution and you won't go to the solution that we know works, which is basically the boring stuff. Getting up, working out, eating right, going to bed and sleeping more hours, eliminating stress, being around people you like, getting rid of people you don't like. You're not going to do that, but you will buy this supplement for $6.99. And that supplement is magically going to fix all your problems. And because they sell it a bright package and they yell at you and they put up confetti and fireworks and do cartwheels, you're now buying it. And people like myself who are basically sitting in the clinic doing the very boring stuff, you rarely will hear from us because most of the time we're not over here selling you anything. We're telling you the common sense basic stuff we know to be true. And we're doing it based off of the 11 years of training minimum. Some of the doctors that I know have been in training 15, 16, 17 years before they start actually seeing patients on their own. So what I say all that to say is, and what PatientZero is saying, is the oversimplification of healthcare and the over-indexing of healthcare on different platforms. You have to pull the curtain back and say, what is their intention? If their intention is to sell you something, then you need to call that out before you go buy. If their intention is to keep you on their platform, and the videos that they're going to show you are meant to feed into the idea that you don't need to click off of the platform, then you need to think about that before you start looking at these videos as gold. And if you can start doing that, it will allow you to potentially get healthier because now you're following and listening to people who are not only invested in helping you, but also have reason and training to do it in a correct fashion. Not to do it in a way that is just more so getting you to click on stuff, buy stuff, and then keep coming back and saying, oh, that's the best thing ever, when you're not getting any better. It's almost like the PatientZero, the old pastor in the churches that would basically want you to sow a seed. And if you sow a seed, it's going to magically help you get better because you're doing this, that, or the other. And the pastor drive off in the nicest car or the private plane, and you got to go ahead and catch the bus to go home. It's the same thing. It's people selling snake oil. And I think people need to understand that just being on these platforms are helpful. And the fact that you have access to a specialist who may be able to train you and help you get to a solution that you otherwise wouldn't have access to is amazing. But you can't do it with any and everybody just because they got a lot of followers and they have no training. And I bring that up in my closeout before we go to the break is I will thank I want to say Surgeon General, potentially. The current Surgeon General, prime example, literally did not finish residency and literally somehow is the top doc in the country when they didn't finish their training. But because they have a good social media following, they sell stuff very well. Somehow they got a way to fail upward. Doesn't make sense, but that's the world we live in. And we're hopefully trying to get you to realize that's a problem. And you shouldn't think that that's the way to do things because it ultimately hurts you more than it helps you. With that, we'll come back right after this.
Looking for a professional office space that makes it easy to focus on growing your business? At J. Kenba Executive Suites, we offer turnkey office solutions with stylish furnishings already in place so you can walk in and get right to work. Our leases include access to Wi-Fi, managed building access for security, on-site parking, utilities, and regular cleaning services, giving you peace of mind and a workspace that's always clean, secure, and business-ready. Whether you're a mental health professional, insurance agent, notary, or other service-based entrepreneur, we provide the professional environment and amenities you need to impress clients and operate efficiently. And if you're not looking for full-time office space but need a place to host a workshop or small meeting, we also offer conference room rentals, perfect for off-site meetings, trainings, and workshops. Schedule your private tour today and see the difference for yourself. Visit jkenba.com. That's www.jkenba.com to learn more and reserve your space before it's gone. At J. Kenba Executive Suites, we provide the professional space. You create the success.
All right, we are coming back in for segment 2 of episode 48, and we are talking about over-indexing health online, whether it's AI, social media, web searches. The idea is that those are tools in your toolbox. They shouldn't be the solution to everything that is potentially giving you the answer, where you're basically avoiding doing the work that we know to be tried and true and works really well. So PatientZero, before the break, we had, in my opinion, a really good discussion about this. And I think people who are listening, who really and truthfully get what we are trying to do here at Byja Radio, will buy in and say, yeah, look, I hear what they're saying. Maybe I have gotten a little bit off the chain with my Oura Ring or my Fitbit or my smartwatch, whatever the case may be, and I'm not actually doing the work. I'm just kind of really focusing on data, not getting to things. What are some things that come to mind besides those devices, those wearables, that you may say people are kind of really going hard on, whether it's online, social media, whatever, because I'm sure there's a bunch of stuff coming from the patient side that you say, man, I hear about this stuff all the time, or these are things that come across my feed.
Sure. So I'm gonna kind of do a couple of things. I'm gonna talk about some things that I've heard. I'm gonna talk about some things in the notes. Like this mushroom coffee. Like I don't care how much mushroom coffee that you eat. That you drink. If you eat a diet of like chiwis and and Zapp's potato chips, which has been giving people salmonella for some reason, but if that's your diet, you're not gonna be healthy.
Is it something with a T? It's the one that's Takis.
Dog, kids love Takis, bro. Like I didn't even know what that was because I didn't grow up with that. We grew up with like regular people chips, like Doritos and Cheetos and Lay's. They're like Takis. I'm like, what is that? I don't know, but it's
to your
some
point,
hot chips.
Yeah. To your point, if you're eating those things, it's going to be a problem, right?
Correct. If that's all you eat, you're not eating balanced meals. You're just eating crap. Just because you drink mushroom coffee doesn't mean that you're healthy, right? Peptides, cold plunges, IV hydration. That's another one. If you're out there drinking every night, all day, and you just get a little IV bag, you feel a little better. Are you healthy? Not really. Biohealth, biohacking, red light therapy. What is red light therapy anyway? Is that what TLC was talking about? Is that the red light espresso? Because I can see how that might make people feel better, but that doesn't make you healthy.
And
what is that?
And I think you're kind of making my point. The idea is that you can name or rattle off a lot of health fads and health crazes. Different things are just packaged differently now. It's on social media. It's on these platforms where they're basically selling you something. They're selling you hydration. They're selling you biohacking. They're not telling you to do this and then leaving you to your own devices to figure it out. They're literally telling you, you should do this. And if you buy it from me, it's going to make you feel better. That's no different than those old infomercials, right? I'm going to give you a few that you may remember, and I'm just rattling these off the top of my head. Do you remember the Thigh Master?
I definitely remember the Thigh Master.
So that's an example where we know you want to have legs that look more healthy and defined. So we are going to
sure.
sell you a product. And if you buy it, it's going to magically make you healthier. But you have to actually do what? Use it. You have to work out. You can't just buy it and it's going to fix you. The other one that I think a lot of people are surprised about that failed miserably, or they didn't realize it was a gimmick, but they thought somehow it was going to magically work. The shake weight. You remember that one?
Oh, I do remember that one. I always thought that one was stupid.
Well, but that's the point. People are getting, in essence, duped. And that's the simple, nice way. And that idea is that they are somehow like surprised. Well, this didn't work. I mean, I spent all this money on this red light therapy and it didn't fix my migraines, because it never was about red light therapy. It's about lack of help. And the idea that because you saw it on TikTok and because such and such put music to the video and that they somehow, again, had cool transitions, it's going to magically fix your migraines. It's not how it works, people. And we're trying to tell you that this is not the way that it's meant to be. And one that is super surprising to me that most people were surprised about when it didn't work, the shake weight. I'm just like, well, how could it not work? I mean, what are you talking about? A weight that you don't actually lift, you just move it around and somehow it's going to magically make you healthier. It is people preying on your gullibility. And if you're gullible, don't be surprised when people take advantage of you. You have to basically say enough is enough. I'm going to listen to people who are incentivized to win with me. Usually your doctor is incentivized to win with you, because if you start to live longer and you're healthier, you're going to tell other people, and then you're going to send people to that doctor. They're not selling you a product that when you fail miserably, they then tell you come back, well, you bought the first one, but you got to buy these other 3 and then it's going to work, because the first one didn't work. You buy 3 more, it's going to work. That's the part that people fail and fail miserably. And PatientZero, as you said, all of the things that you're talking about, what are the things that you think go along with that for those people who are looking to buy? What type of lifestyle do you think they have?
You have to change your lifestyle. So like 2 examples for me, 2 gimmicks that PatientZero bought into. The Apple Watch. Number one, first of all, the Apple Watch was the biggest hater you ever have, right? Because you just be chilling, minding your own business. Apple Watch is like, hadn't gotten up yet. Activities kind of light. It just makes you feel like you're just the laziest person ever. Like you could have just went on like a 30-minute bike ride or something like that, hour bike ride. 2 hours later, Apple Watch was like, your lazy such and such is still chilling. And I'm like, bro, like get off my back. So that was one gimmick for me. The other gimmick is a Bowflex. So PatientZero bought a Bowflex like a few years ago. Right? And look, now granted, Bowflex then collected a lot of dust in this day. I'm not gonna sit up here and make you think that I was just on the Bowflex the whole time. Now I did use it a lot, right? I think I feel like I use it more than most, right? But you know when the Bowflex really started working? The Bowflex really started working when I cut back on my daily dose of Haribo gummy bears. See, when I wasn't eating Haribo every day, all of a sudden I started losing some weight. I started seeing some results, but I had to kind of change my diet a little bit. I had to change my behaviors. And I think that's the whole point of this, right? Because some of these gimmicks work. Like I never bought a Thigh Master, but if you start eating salads, I'm pretty sure the Thigh Master could work, right? Or if you one of these Peloton people, I feel like that's like a cult. But if you like one of these Peloton people that just live, breathe by the Peloton, I'm pretty sure that can work. But you can't go out there and just have your daily dose of Skittles and whatever else people eat. You have to change your diet. And I think some of these gimmicks, they're presented to you in a way where people like to take shortcuts. Everybody knows what we need to do. We need to exercise. We need to eat somewhat healthy. We need to have somewhat of a disciplined portion control. And we need to, just take care of our bodies, right? You got to get a good night of sleep. You got to do all the things. But these gimmicks are presented in a way it's like, if you drink this mushroom coffee, you ain't got to eat right. Or if you hit this Bowflex, You don't have to get 8 hours of sleep. You can sleep for 4 hours and be completely healthy. And I think that's where we mess up with a lot of these gimmicks and a lot of these things on the internet, is because, you can't just ignore basic physiology just by using some type of technology. It's
Correct.
just not going to work.
Yep. And I think the other part that I'll drive home that you hit on, and we are going to hopefully solidify this in people's brains. And if not in their brains, they're going to potentially at least say, I heard this somewhere and it kind of made sense when we framed it this way. I'll ask this question, and I've asked this to you before, Patient Zero. I'm hoping you'll remember this and you'll, hopefully keep me honest whenever I've done this with other patients. Between diet and exercise, which one is more important? That is the question that I always start with. Between diet and exercise, which part or which option is more important?
I would say both of them are like extremely important. But if I had to pick one,
Got to pick one.
I would pick diet.
Okay, great.
And
So
when we
got
say diet, that means what you normally eat. Because a lot of people want to go on a diet, which is something that they can't, that's really unachievable. Like all of a sudden, you've been eating pizza and burgers for every meal, and now you just want to eat salads all the time. Like that's not what we mean. We mean like what you normally eat on a consistent everyday basis. But go ahead.
So you hit the first part, right? So what's more important between diet and exercise? It's diet. But the question then follows up as why is diet more important than exercise? Well, what I tell people is if you work out every single day in a 7-day week, how many workouts are you probably going to get in? Most people would say 7.
7.
But if I ask you how many meals you're going to eat in a 7-day period, most people have a variation of answers. Some people are going to say 14. Some people are going to say 21. Some people may say more. But all that comes down to if you have 7 really good workouts and 21 bad dietary choices, doesn't matter how well you work out and how often you work out, you're going to have a problem. And you're going to have more problems than you will that you can outrun, workout, out bench press, out curl, out stair climb. Whatever you're doing in the gym will not compare to those 21 bad meals. And if you feel like 7 workouts are going to somehow cancel out 21 meals, go ahead and try it. And I feel like if you're already doing that, you're seeing very minimal or no results. So we have to get to the boring stuff and not the fads and the healthcare trends and the crazes with the idea that they're going to magically somehow balance each other out. It's not going to work that way. It never works that way.
Have you ever seen somebody who's like jacked, where like they got the chest on point, the arms and all this good stuff, they just swole, and they got this huge belly? Ain't that the funniest looking thing ever? Yeah. Like you see that, right? Like from the chest up, they shirts fit all great and stuff. Then under the chest, they look like they got like a pregnant belly. You know what I'm saying? Like it's just, to me, that looks awful. But that looks like somebody who, to your point, in the gym, lifting all the weight in the gym. But after the workout, they're like, I can go get 2 Domino's pizzas for $10 a piece, and I'm just going to eat a whole pizza after working out. And it's like, that defeats the purpose.
Yeah, it does.
So you can be swole, fat belly man if you want. It just doesn't make sense to me.
Sounds like a very interesting superhero character. I think we should create that. Swole, fat belly man.
We should. His kryptonite is broccoli. We should do that.
That's a great kryptonite, I would say. All that being said, to again drive that point home, the boring stuff works, but you have to do it consistently. Do it when no one's looking. Do it when there is no camera. We just had a rant a couple of episodes ago about working out and having cameras up to do all the workout stuff because you want to look good on social media and make sure everybody can see you working out, but then you leave out the gym and have the worst lifestyle, from dietary choices to stress management or lack thereof to poor sleep to not being adequately hydrated. Again, the show is not the thing that people really and truthfully enjoy as much as the work if they do it the right way. You enjoy the work because you know the show is going to take care of itself. But if you're more worried on the show and the product that you're putting out into the world and less worried about the consistency in the work, you're going to have a problem. If you're taking a bunch of supplements, thinking the supplements are going to fix your bad habits, that's a problem. And I have plenty of people who come to our clinic, and we have to hopefully rewire their thinking that, oh, I take 28 supplements and that's going to magically fill in this gap of me not sleeping a full 7 to 9 hours of every night. It's backwards. So we're going to continue to see these bad outcomes. And it's going to continue to happen because people are geared towards cyberchondria, as I mentioned earlier. They're geared towards negativity bias. They're geared towards these sensationalized headlines for healthcare. And they're not thinking, well, eating correctly, working out properly, sleeping consistently is going to actually keep me healthy. It's let me buy the latest device, watch the latest trend, buy the latest thing that someone's selling me, and then be really upset when I get to the doctor and our labs don't reflect better numbers. It's not surprising. You want to do the work so when you do get labs for someone like myself and your physician sits down and they tell you, hey, your labs look great, it's no surprise to you. It's not a you wishing, hoping, and praying that the labs are normal. It's I put in the work, I've stuck to the diet, I've listened to the advice of the professional, and I'm following their actual game plan. So I'm going to have a better result. And if you can do that, that works out much better for you. You're not going to be one of the 6 in 10 people that have chronic diseases in the United States. You're not going to be one of those people that have a 25 or less % chance of a negative health outcome happening. You're going to be those people who are pretty much saying, you know what, if something bad happens, I did everything I can to mitigate that risk. And sometimes bad stuff happens, but it's not me doing stuff that sped that process up. And I think ultimately we can do better with that.
You know what? Here's what I got to say. You know, I'm gonna call this patient zero personal privilege, because I'm about to go rogue, no pun intended, off the outline right quick.
And let me just
I got
say,
to say it.
Is this the patient zero rant segment, or is this something different, or a little bit of both?
It might be a little bit of both. Let's see how it happens.
Okay.
You know, because I don't know how this is going to go.
Let's see it organically come to fruition, because it's an art form.
Yeah, let's see what happens. So here's what I'll say. I'll say life is really, really hard. Life is very hard, especially as of late. You know, I left my house today at about 12:30. I went vocal, right? The gas station by my house was $3.65. I came back at about 5 o'clock, so you know you and I can record this episode. The same gas station was $3.99. The gas jumped up 34 cents per gallon in a couple of hours. Now, I'm not going to get into politics. We know why that's happening. I'm irritated with it. You know, that's another rant for another day. You might have to catch me at the bar if you want that rant. Not on the area, right? So what I'll say is this. Life is really hard right now, and it's not getting better. Life is very, very expensive. You know, people can't buy groceries. I saw the Ford CEO the other day. He was on there talking about the average new car, $50,000, where we said average new car, not average luxury car, you know, $50,000, you know, property, like everything's expensive. You can't just live out here. So what's happening is people are cutting corners, and understandably so. You know, you have to be able to live more efficiently to make it. But there's 2 places where I think people are cutting corners that we cannot afford to cut corners, because I don't care how much money is in your bank account. If your health ain't on point, I'm here to tell you it don't matter. So number one, what's happening is it's much easier for me to go buy ramen noodles, or it's easier for me to go buy pizza from Domino's, or it's easier for me to go through McDonald's, even though McDonald's ain't cheap as it used to be. It's still cheaper than eating healthy, because I done worked all day. Cooking all the time is not an option. I have to pick up something, and eating crap is better for me, or better for my pockets, than it is to go and eat something, a quality meal. So we're skimping on the quality of the foods that we're eating because of how expensive everything is. And I'm here to say to you, I get it, but you can't afford to do that because long term, that's gonna hurt you more than it's gonna help you. That's number one. Number two, the second way we decide to skimp on things is by all this technology. You know, I get it. Dr. Jasper has had all these years of experience. There's a cost to see him, even though for me, my cost is probably less than somebody who goes to like urgent care and somebody who goes to their primary care, use their insurance and all this stuff. Shameless plug for Byja Clinic, right? Because it's amazing. And I feel like I'm at the healthiest I've ever been in my life. I feel really good, just to be honest. Shameless plug, not so shameless. But my point is, seeing your doctor has a cost associated with it. And we understand that. However, let's not cut corners or try to help your finances by not seeing people like Dr. Jasper and relying on ChatGPT, WebMD to take his place, or God forbid, mushroom coffee. So if I drink mushroom coffee every day, that does not mean I don't have to go see Dr. Jasper. If I'm using my Thigh Master, that does not mean I don't have to go see Dr. Jasper. If I can't perform, if I eat a Blue Chew, that does not mean I don't need to go see Dr. Jasper. You know, like you can't just keep using all these gimmicks, looking up things on ChatGPT, WebMD, Google, God forbid, TikTok, Instagram. That does not take the place of seeing your doctor because number one, the information is general information. ChatGPT didn't see your leg that you injured and knows what's going on with it. ChatGPT did not read your blood work in your labs. ChatGPT does not know your family history. You know, WebMD doesn't know all that. So they might have these brilliant explanations written by people who've been trained like Dr. Jasper, but they haven't seen you. So you could be hurting yourself and you could be making yourself really, really sick by finding some information that you saw online and using that information to heal yourself versus going to the doctor. And look, again, I love technology. I love the fact that we have all this at our fingertips, but these things should be suggestions. They don't take the place of a doctor. So as a good patient, what I should be doing is I feel like this, right? I feel like, I don't know, I'm a little sluggish and I don't have the energy throughout the day that I should. I put that in ChatGPT. ChatGPT says, well, perhaps you have sleep apnea, or perhaps, you know, your heart isn't beating the way it should. Then I should take that information and I should go to Dr. Jasper and say, hey, what do you think about this? And we should have that conversation from there. That's what the information should help you with. It shouldn't be, well, I read that I may have sleep apnea, so let me go buy this little $20 piece of plastic I saw on the internet that might open up my throat and my airwaves so I can sleep better at night. Because guess what? It might not be that you have sleep apnea. It might be that, you know, you're tired, your heart is working overtime, and instead of going to see a cardiologist to help your heart, now all of a sudden you got worse and you didn't address the issue when you had the opportunity to address the issue. So I said all that to say this. I get that life is hard. Everything's expensive. So I don't look. I'm gonna have to get a second job just to put gas. Look, I drive a V8, ladies and gentlemen. That's $4 gas is not looking attractive to me at all, right? You know, I might have to find some family members and start me a band like the Jacksons did. I don't know. We will see. But I understand. I'm in it with you. I understand that life is hard. Things are expensive. It's not getting better. But the two ways you don't cut corners is eating a whole bunch of cheap crap and not seeing your doctor. That's going to cost you in the long run. So that's all I got to say on that.
Yeah. So another epic rant, but an actual healthy epic rant, because some of the rants I've gotten comments that are, let's just say they are very entertaining rants. Don't necessarily help with health, but this one I think actually did. So I think you threaded that needle very nicely, PatientZero, where you're helping people and ranting at the same time. So kudos to you. Well done, my friend. I will
I
also
appreciate
say,
that.
I will also say, because I think we're getting up on time here, that you have to prioritize health more than you prioritize a lot of other stuff. And if you do that the right way, you will end up getting the other stuff that you normally would prioritize because you have health. I've had patients and family members, and I literally have emails today, PatientZero, where a patient's significant other is asking me if the patient can make an appointment on Saturday because they can't miss work. And they want me to somehow magically accommodate a Saturday appointment when the clinic is normally closed because the patient can't miss work. Now, what do you think my first response to that patient would be? And it's not a complex response, it is very simple. You're prioritizing health after you prioritize your job. But if your health goes out the window, will you still have your job? The fun thing is if you actually did it the other way around, where you prioritize your health over the job, you probably are going to keep both. But if you prioritize your job over your health, you're going to lose both. Like, it's backwards that we don't see people thinking that way. It's backwards that we'll have healthcare professionals who are often somehow telling you how to be healthy, but they don't practice what they're preaching. And they're telling you that you need to sleep, but they sleep less than you. Well, you have to start literally walking it like you talk it. And that goes for any and everybody. You can't sit here and think because you go to the gym and you don't come to the doctor that you're magically going to be able to tell people how to live healthier. It's no different to me than a person telling you how to invest your money and they don't have a brokerage account. It makes no sense. So if that's the case, we need to not only do what PatientZero says, don't cut corners, but also try to find a way to prioritize health and not cut corners because you think cutting corners and not prioritizing health by going the old-fashioned, boring way of coming to the doctor, letting us help you, letting us educate you and guide you. Somehow that's not necessary until you actually are grabbing your chest, falling on the floor, and people are surrounding you saying, this person is so young, I don't know how this happened. Well, we know how it happened. They didn't listen when we have told them for an hour and some change, week after week, year after year, that you need to potentially do better and prioritize the health that you have now before it's no longer with you. So all of that being said, I think people hopefully will get that AI has a purpose. Wearables have a purpose. Different technology, different websites, different social media platforms all have a purpose. You need to figure out what that purpose is and learn how to incorporate that into the bigger picture of how to be healthy. If you don't want to do that, don't be surprised when bad stuff finds you from a health outcome standpoint. So PatientZero, since we're going to slowly, go ahead.
But things, I'm sorry, a couple of things. Number one, if you die and if you live in corporate America, you work in corporate America, or you work in a plant, or you blue collar, whatever you do, I promise you this. If you die, your company is going to have their job requisition up to replace you before you're buried. If you die, your company is going to have their job requisition posted for your replacement before you're buried.
But
prioritize yourself.
But people don't hear you until after something bad happens. I'm literally hearing you say that. And it's the same thing I say all the time. I can't miss work. I got to cancel my appointment because my job, this, that, or the other. And I'm not saying don't go to work. I'm not saying that your job is not important, but it has to be give and take. If your job is making you miss health appointments, they don't prioritize your health, then that tells me you're not really a big part of that company. Because most jobs that know you're very important are going to let you go to the doctor because they want you healthy to come back to work. It really isn't that complex, but somehow we don't understand that. Well, I don't want to miss, and I'm going to go to my doctor friends. I don't want to miss work because my patients are going to be upset. What they going to do if you're on the floor and you didn't pass out?
Nothing at all.
Nothing. So why are we over here now prioritizing their health over your health? It has to be you taking care of yourself first.
So a little background, right? You know, there's, especially the bigger companies that you are, right? There's a thing called self-funded insurance, right? You may have a policy, but your insurance is self-funded because that's normally cheaper for bigger corporations, right? So these bigger corporations, they provide you with health insurance, and they essentially are paying for these claims that you make, right? So just so they would prefer that you go to the doctor and stay healthy, because if something chronic happens to you while you're still employed with them, they have to foot the bill. So not only are you not prioritizing your own health for the job, you're actually not doing what they would want you to do at the job. Because if something bad happens to you, it's going to cost them more money. So please prioritize your health. If you gotta miss, if you gotta be late, or if you gotta take some time off, or whatever you gotta do to go to the doctor, prioritize your health. And second thing, and I'm happy that this week's rant actually helped people, but pockets on shirts is still stupid. I don't care what anybody says.
All right. Well, I think we are getting up on time, PatientZero. We're going to close out. Any quick closing thoughts? And then where can the people find you?
I mean, that's it. Don't buy a shirt with a pocket on it. And you can find me, same place you'd always find me. George_Becknell on Twitter, Becknell Media on Instagram, and George P. Becknell II on LinkedIn.
All right. So for my quick closing thought, health crazes usually are meant to do exactly what they do, make you crazy and make you do crazy things. One that I'll throw out there that I want you to really and truthfully think about and stop is spraying stuff on your feet, thinking that's going to magically help you sleep. Don't make no sense, still doesn't work, and you just wasted your money, or you wasted your significant other's money, and you still ain't sleeping good. So with that, do better there, and hopefully we can actually get healthier, because we'll potentially obviously use common sense.
So what are people spraying on their feet?
Magnesium spray. That is the thing that I've heard recently, where I spray magnesium somehow on my feet or in my pillow, and somehow that's going to help me sleep better. Still to this day, don't know where it came from, but hey, go ahead, do you, waste your money. And then when you finally come back to us and we get you sleeping better with other stuff, you can definitely go ahead and donate your magnesium spray to somebody else. Now, before PatientZero asks more questions, because we got to close out, I'm going to also say you can like, subscribe, share, follow, comment, and make sure you are doing the due diligence of getting people onto Byja Radio Show. Because, again, we're trying to keep you healthy and keep you and your family around for long periods of time. With that, you can find us at Byja Clinic at our website, www.byja.org. You can find our nonprofit, the Byja Charitable Alliance, online as well at and that is our nonprofit arm that is focused on getting access to those who otherwise would go without health access through the direct primary care model. So if you'd like to donate and help somebody get access to health care that otherwise may have to go without, feel free to do that. Those donations are tax deductible. Online, that is our two websites. You can also find us on social media, LinkedIn, Facebook, and Instagram. We're at Byja Clinic. And then last but not least, you're listening to Byja Radio Show. We appreciate you, and we hope you come back and see us next time.